Thank you for joining. Welcome to the first in our series of patient webinars. My name is Curtis Carter, and tonight we're happy to introduce you to the CeQur Simplicity insulin delivery patch. It is actually my pleasure to introduce our guest speaker tonight, Colleen Miller-Owen. Colleen is a nurse practitioner in a busy multi-specialty practice in Florida and has been using the Simplicity patch with her patients since earlier this year. We are also joined by two of her patients, Vesta and Max, who will share their journey in choosing and using Simplicity to deliver their mealtime insulin. We hope you enjoy the program and ask that if you have any questions, please use the Zoom Q&A feature, and we will address those at the end of the session. Now, let me turn it over to Colleen to get it started.
Thank you, Curtis, and thank you everyone for joining. I'm really excited tonight to talk about the CeQur Simplicity patch, and I'm very excited that I have two patients, people with diabetes, that are actually using it that can share their experience. So what we're talking about is the CeQur Simplicity patch. So this is a little insulin delivery device. It's worn on the body. There's a little catheter that's inserted into the fatty tissue, and it delivers mealtime insulin. You can wear it for up to 3 days. It's nice and flat, so you wear it on the abdomen, but you can see it doesn't stick up too much. You can see there. It's indicated for people with type 1 and type 2 diabetes, as long as they're 21 years of age and above. It does insulin in 2-unit doses, so each click is 2 units. So click, click, click. So 2, 4, 6, that was just 6 units of insulin by doing 3 little clicks there. In my experience, my people with diabetes have had great success with this, and they found it's convenient. So they have the insulin right there when they're out and about or at work. They can take their doses. It's discreet, so it can be worn underneath their clothes, so they can inject in private or take their insulin in private as opposed to pulling out a syringe. So they're kind of living an injection-free life and are happy about that. As a clinician, when any new product comes out, I need to make sure that it's safe and effective before I recommend it to people with diabetes. And in the clinical trials with the CeQur Simplicity, just after 24 weeks, the average A1C drop was 1.7%. So patients dropped their A1C 1.7%. So that's a huge improvement in their diabetes control. Many of them actually got to that goal of less than 7%. And then if they were using a continuous glucose monitor, their time in target range went from average of 48% to an average of 74%. And that's the goal with a continuous glucose monitor. We want to be in target range 70% of the time or above. So with the CeQur, we got close to that A1C goal, big drop, close to the 7% in time and range. So like I said, my people with diabetes have had great success, and we're going to introduce them here, and they're going to answer some questions for us. So I have Max and Vesta here. They're two people with diabetes. So just quick, Max, can you tell us how long you've had diabetes and what type of diabetes you have?
I have type 2 diabetes, and I have had it since I was 35.
And you're 36, right?
Mm.
So you've had it for a few years. Okay, and Miss Vesta, how long have you had diabetes, and what type do you have?
I have type 2, and I've had it for 30 years.
Okay, so you guys had a lot of experience going into this, correct?
Yes.
Correct.
Okay, so then Vesta, how did you manage your diabetes prior to the CeQur Simplicity patch?
I didn't. I was non-compliant, and my blood sugars went high. When I first became diabetic, if my sugars went high, then I just gave myself a little insulin and ate what I wanted. But that caught up with me. So the patch.
Syringes or pens?
I use syringe and vial, and then the pens came out. And the
Okay.
pen was so much more convenient, but you still have to stick your finger 4 times a day. And 30 years of that was, your fingertips are numb.
Mhm.
But with the patch, you don't have to do that. It's awesome.
Okay. And Max, how did you manage your diabetes prior to the patch?
Prior to the patch, I was on pills. Metformin was one of my main medications, and that was for about 7 years after I was diagnosed with diabetes. But like Vesta was saying, I was kind of like the kind of person that will use the medication, but I still would want to do my freedom of food and events, and sometimes not taking care on a specific time when I needed to take the medication, and because of my job as well. Sometimes if I was traveling or on conference and meetings, time went off and my medication time, was not done properly. Eventually it got off to me to the point that at the age of 42, I ended up having to use insulin. And I was definitely, recommended with Novolog was one of the medications to use, and eventually later on with a another insulin that I put at night, which is Lantus. Um, but even though like that, I was still struggling with the timing, not eating exactly at the right times, sometimes just eating on the run, and at the same time not having a well monitor sugar, again because of the fingertips, that you have to kind of like punch yourself to it. And sometimes in meetings you just don't want to do that, and having to go to the restroom every other time for that, it was another of my problems. Even though in my office I can definitely do it anytime, when I'm here. But Finally, overweight. I became overweight. That was another problem for me. So other complications came. And during that time, I had to make a decision. And with all this time and trying to make decisions and how to do the day-to-day life, in December 2020, I basically end up with a heart attack. So I have to make string measurements. And after that, I basically went to a rigorous change in diet, as well as exercise. And, having my primary physician was one of the things, but having an endocrinologist on my side was even better. So we definitely started talking about plans and ideas. And I was just saying about all my natural products that I was trying to use and coordinate one thing with the other and combine all the ideas between my cardiologist, my endocrinologist, my primary physician, and whatever I found. And I was able to find some way to do it, which was working because thanks God, my A1C never been above 7.4. But still, I needed to do something more to get it into a better number. And that's when my endocrinologist basically gave me an opportunity to use one way to have a sensor in my system that will help me to know when my sugar was going high or low. And then eventually, this year, I basically was introduced to the CeQur Simplicity patch, and that was my kind of like blessing in the sky, because for the first time, I can have my meal insulin right in my body for 3 days, not having to worry where I am, what to do to get there. And I was able to not only check with my sensor my level of sugar, but my sensor also will tell me when it was getting high. So I was able to respond right there and then. And since then, my A1C has been 7 or below 7.
Awesome, awesome. I think both of you kind of alluded to the fact that taking mealtime insulin can be difficult, and having to stop to in the middle of something, or when you're at work, or when you're on the run, it's difficult to take. And so that sometimes patients with diabetes do miss injections, or they're not, I think Max, you said timed. We know that Novolog and Humalog really needs to be given before we eat, but if I'm out shopping and I forget my stuff, I'm in trouble. But now you've got it right on you. And I think both of you are doing so great with that. Because did you ever miss injections before, Vesta?
Yes,
Okay.
I did. Sometimes I'd walk out the door and forget my glucometer, or I'd forget my insulin. And you know, this is just so much easier this way. It's just been a blessing. And I would miss doses, but then I would think, yeah, it doesn't look like it really matters, because by the time I get back home, my sugar go down. So it's frightening not having a constant monitoring system going.
And so Max and Vesta
having your insulin so available.
Are lucky because they have continuous glucose monitors, and so they can see their blood sugar all the time. And now with the CeQur Simplicity, they can actually respond to that.
Colleen,
yes.
If I can add something more, I can show you exactly how I used to monitor myself.
How is that?
I have not only that, but I can show you how I used to carry my insulin.
Okay.
This was my day-to-day during the day, during the night. And then inside of it, it was only a package like this. This was my insulin.
Okay.
This is me carrying my insulin. And this is me carrying the monitor to be able to check my sugar. So it's just unbelievable if you have to do that. Nowadays, I don't have to carry any of these. The only thing that this is good for now is my lunch.
As it should be, right? And then you can do.
As it should be.
Okay. So I think both of you, just with the challenges of life, sometimes taking insulin at meal times can be a challenge. But we've got a way that's simple to get it done. Do you remember your reaction when I first showed it to you in the exam room? What did you think about it? Did you think, oh, this is cool? Is she crazy? What did you think?
I think you remember my reaction. It was like something that's anything that can get me out of these needles.
So we're going to reduce the amount of manual injections that you have to give. So you're very receptive to it.
Yes.
How about you, Vesta? Do you remember?
Well, you know, I had to jump through hoops to get approval to get the Dexcom, the monitor. And then when you introduced the CeQur Simplicity patch, it was like, oh my gosh, I can't wait. Put it on, hurry. And the training was very simple. It's very easy to understand. And to me, simplicity means simplistic. So I was shocked when you offered it. I was just so pleased. And then when I came back for a follow-up, you asked me, what do you think of your CeQur Simplicity patch? I don't think I gave it enough excitement, really. I was so excited. I couldn't wait to get back to the office to tell you how well I was doing. But you can also, I mean, you can see a change in your lifestyle. And it's amazing. I'm not going to leave the house and forget something. It's just always there. And that's what I am so pleased about. It's always there.
So both of you are very receptive. Not everybody is always right away that receptive. But I think that if you just kind of hear some of the little things that we're talking about, how easy it makes it, how convenient, it's right there. I think that does make people intrigued and want to try it. And then I think when they're hearing your experience, that's been good. Hopefully more people will go on. I've had good success with people being interested in it. So how was the transition from injections to using the patch? You know, you have to be trained on this. So it's not, you know how to use a pen or a syringe. How was training, Max?
Training was amazing. Basically, Curtis sent me a link where all the processes are, which you have a visual of exactly how to get it out of the box, how it's supposed to look, how to check the package before opening, especially for expiration date, and then it was how to put everything in position, how to get the syringe, how to prepare the syringe, put the insulin inside, how to calculate the amount of insulin that you need. That is even awesome because in my case, I use 8 to 10 units per meal. So what I did is I took the highest dosage, which is 10. I'll multiply it by my 3 meals, which is basically a total of 30. And if it's for 3 days, it's going to be 90 units. So to those 90 units, just in case anytime I'm going to need any extra, you add the other 20 units and that will be a total of 110 units that I will carry on my uh, Simplicity patch. And it has worked for me. There have been times that I have used almost up to the last drop in those 3 days. So basically the calculation, it was really, really good. But what I like is that everything is simple, easy to learn. And if you still have a process that it take you a little longer, you could see the videos while you're doing it, and it basically works.
So training was real easy. How about for you, Vesta?
It was real easy. I came to the office and a gentleman taught me how to do it. It was easy for me because I've been doing injections for so long that the syringe was not a problem. And then all you do is just squeeze it into the patch, apply it, pull the part off, and put your date sticker on it because you may not remember when to take it off and put a new one on, which I've done. But I fill mine to the max. I always do because I have to do more than usual. And I fill it to 200. That way I am sure I've got enough to last me 3 full days. And I don't have to use the syringe, the pen to, to back it up. So I'm real pleased about that.
Yeah, so you have to put 100 units in here, and then the maximum is 200. And every patient is going to be different of what their needs are. But again, that's what's great. We can individualize it to what you need. It's good to have a little bit extra in case you're sick or you have an ice cream cone, or next Thursday you have pumpkin pie or something like that. So you need to have a little bit extra. So using it, just learning how to fill and apply was easy. And then it sounds to me like incorporating it into your life was pretty easy, that you transition from the injections to the clicks pretty easily, correct?
Absolutely.
Yes.
For me, it was kind of like there were moments that I have to say, do I really have it on me? And it's true. It's like it was a little bit of disbelief that there's this easy, accessible equipment in my body that could give me a little bit more freedom than what I ever thought I could have. And that for me was what I wanted. That was one of the things. And then not only that, but let's talk about the results. When you get the first results of your blood test, it's just unbelievable.
Awesome. So incorporating it into your life or wearing it, it's not something that's obtrusive. You don't really be able to sleep with it and bathe, go in a hot tub, all that good stuff with it. No problems with that?
Not at all. The patch is a patch that you could wear, and it's also water resistant. So you could take a shower, you could even swim, you could do certain things that you think that probably you can. At the beginning when I started, because I haven't finished, at that time I didn't finish reading all the other information, I was basically covering it with tape, a very white tape in this section to be able not to get it wet. And then when I got into that point, I said, say what? I don't need to do this. It's like, that was even more freedom because I said, well, I probably have to protect it. But now I know that it works no matter what. It's for 3 days and I could do almost even sports. You could sweat, through the sports and everything, and it's fabulous. You take a shower, just damp it, make sure that everything is dry and everything. But other than that, it works fantastic.
And how about you, Vesta? Does it bother you? Do you know that it's there?
No, I feel to make sure though. I don't want it to come undone. So I'm always making sure it's still there. But it's just, in fact, I put it on my middle and, well, my big inner tube here, and if you can see it bulging through my shirt, people will say, what is that anyway? And I'm so happy to tell them all about it, but I'm not ashamed that you can see it under my shirt. I know it's there and it's working, and it is just, it's changed my life. It really has.
Awesome. That's awesome. So any challenges with changing over? Like, I mean, it sounds like everything's been really good, but sometimes, I mean, any challenges inserting it, dosing, anything like that?
Not at all.
No,
I
me
usually
neither.
put my patch around 11 o'clock at night, which is my most freedom time. I try to pick a time where nothing can bother me, just to do everything exactly the way I need to do it. And that is easier for me also when I have to replace it. So 11 o'clock at night is my time, 3 days after, and that's what I do.
But that's good. So that's a way you've incorporated into your life and knew that you needed to have a little bit of time to put it together, and that so you didn't want to have anything in the way.
Absolutely.
I do mine in the morning
Okay.
because that, I'm retired and I have a lot of time, but I make sure that I do it in the morning so that 3 days after I know, change it, it's morning. But I always use the sticker, the date sticker.
Yeah, and Vesta reminded me there's a sticker you can put on there that I don't know, because this is probably a little bit worn, but we need to change it every 72 hours. So it'll tell me when it was put on, when I need to change it, so that I do that, so that, that was something that you guys had to work into your life, is I need to do this every 3 days, but it sounds like you figured that out pretty quickly and are on track with that. So what successes have you had with the patch, Vesta? Tell us about that.
Well, my A1C was 12, which is like I should have been dead. But my A1C was 12. And it came down after my patch, it came down to 7.3. So that's my success story. Is
so Vesta was over the top. The average drop is about 1.7%. But I think what's super important is that she got to that 7% goal, because we know if we get there, we reduce complications. So you need to pat yourself on the back from double digits to where we need to be. That's awesome. And that over what amount of time was that? Do you remember? Like, was that every 3 months or?
I was at 12 point something at December 20th. And then I got my patch on March 5th. Well, the next draw for A1C was July, and I had come down to 7.3.
So that's like about 3-4 months that she had that big drop. So that's awesome.
Okay. Oh, and my nephrologist was just tickled to death. She says, it's working, keep it going. So I just, all my doctors have been very pleased with the outcome.
I think that's a good point. We kind of know that diabetes isn't just in a bucket. There's all sorts of other diseases, and that we know blood sugar control affects the kidneys. Max has mentioned heart and stuff like that. So yeah, it's good that everybody else is, all the other providers that you're working with are seeing the success. Hopefully they can kind of say, okay, I got a new gadget that my people used. Okay, and so Max, can you tell us how your success went?
Oh my God, my success started basically 2021 for me is the most amazing year that I'm going to feel very sorry to let it go because this year has been not only a recovery that I thought that it might not be possible, but having to go to different treatments, especially to get me back into my job, and then having to do massive changes basically because I have to do big changes, but changes that were positive is just things that you take for granted that you don't do, but you actually need to incorporate into the day-to-day life. And one of them, believe it or not, as simple as it sounds, is water. I don't know why people do not drink more water in a day. I've been basically drinking this 6 times a day of water with lemon, and that started back in beginning of March of this year. Since then, I was 278 pounds. I dropped to 239 pounds, and I have a fluctuation between 239 to 242, which is what I am today. Um, and the acceptance of water, which was something that for some reason, I don't know, I was kept rejecting the water more, the coffee, the soda, or anything else, but not the water. And nowadays, I don't have my water, and you see me looking for it right away, to the point that I even have bottles in my desk to be able to do this because I want to be able to keep myself hydrated. With that comes an improvement in vision. I don't know how many people, you know, don't re, uh, don't relay or realize that water intake is very important, especially to keep your hydration in your vision. And so that was one of the things. The other one was my appetite control. That was something unexpected. I was always craving for something, and now I have to remind myself that I have to eat. That's incredible. That's something. I'm not taking anything for that. I do have some supplements, but it's for me for control on the sugar and also to help with that. But not with these things. The other amazing thing is I don't know how many of you are going to diabetic retinopathy, and that has to do with nerves as well. And mine is gone.
The neuropathy pain is gone.
I completely gone. My legs are not swallowing. I can walk more. Of course, I am walking more because 45 to an hour basically does that to you and help you out. Uh, and my back pain is gone. My lower
So
back
it
pain
sounds like, I mean,
it's like a chain reaction of things. It's like one thing through the other, through the other. So I'm kind of like waiting to see what other surprises coming to me before the end of the year. But it's
I
been
think that you
positive
kind of talked
all
about
over.
water is a simple thing to do, just like the simple
Simple.
patch.
Look at that.
And then it just kind of expands on your diabetes control improves and you're able to walk more, to exercise more, and everything just gets better and better. Vesta, you said the nephrologist was happy. So the success is certainly with your diabetes control, but that spills over to all kinds of aspects about your life. Any hints or things you would tell people that are thinking about it or maybe hesitant about starting the CeQur patch?
Go ahead, Vesta.
I don't see any reason why they would reject it. I think it is so simple to use. The training is very simple. You get a booklet, and it's like your Bible. It tells you exactly what step to do, step by step, putting it together, drawing the insulin, putting it in, attaching it. It's just like nothing. It's just like you get so used to doing it, you can do it blindfolded. But I would like to see more people use it. Nothing to be nervous about with the patch. It is non-invasive and you can barely feel it going in. So I don't know why people would reject it once they find out about it. I would think it'd be great, a great asset to their lives.
I have to say, I think a lot of people that I've introduced it to, it's like said, "Whoa, that's really cool." That's, I think, was my reaction too. Like, yeah, why didn't we have this 20 years ago. But I
Yeah.
mean, change is hard, and sometimes you have to kind of make those steps. So I mean, I think you're kind of like, just go for it and try it, right? That's kind of you.
Yeah.
And how about you, Max? Anything you would say to somebody who seemed hesitant?
I definitely want to say to them, don't think about it too much. There's enough information out there to tell you exactly how it works. But I have to say, for me, is very simple. If you want to have something so unnoticeable, something very private to you, and to give you the freedom that you need to be yourself in front of others, having not to worry so much about when you're going to put it on, when you're going to do this, and always watching your watch. Forget about it. This, and if you combine it with a sensor that could read you your sugar levels and maintain you informed, I have to tell you, the combination of these two for me has given me the freedom that I wanted to be the person that I needed to be in my job and in my home.
That's awesome. Thank you so much. I'm glad that it's worked out for you, and we're doing so well with it.
I'd
I
like
thank
to
you.
add something.
Mhm.
If you happen to get stuck, or you need more information, the helpline is awesome. You can call in and you can get answers to any questions that you have. There's somebody always there. Or you leave a voice message and they return your call immediately. I've had to do that several times. One time I got a patch and it was faulty. So I called and I told them, I said, hey, I got to have this one to finish out my 30 days. And they said, no problem. We'll put one in the mail to you. I got it the next day. They're
Awesome.
they are so helpful, so willing to help. They make your life easy.
Did you say something, Max?
I was just saying they're very effective and very clear when you have questions, and they guide you really well. But I have to say that link, that main link to CeQur has 7 places for everything, step by step, from the beginning that you get the package all the way to the ending section when you finally locate the package in your body. It's just awesome. The videos are clear. They're very specific, and I just love that. I really do.
I think this is good because it sounds to me like, Vesta, you're like kind of a person who likes to read it and go through it. And Max is probably more into I want to see the video and watch that. So there's multiple ways of learning that CeQur has access for you. I mean, as a provider, I want to make sure that my patients with diabetes do have a problem, that they have someone to call and that things are resolved quickly. And so it sounds like that's not been an issue, with questions or any kind of thing that we were concerned about. That got taken care of right away too. So that's like, from my perspective, I'm glad that you guys are being well taken care of. So
well, it gives you a secure feeling, knowing that there's somebody close by. If you need help desperately, there's always somebody to answer your question.
awesome,
And
'cause
I
don't always
really
answer the phone.
appreciate that. It's been very helpful.
That's actually a great segue that I'll jump in, because we did have quite a few questions asking about coverage, about how to get the product. And so it is a new product, but we are quite happy with the way that the coverages have been falling into place. And I will, just like Vesta and Max, I'll point you to our toll-free number for CeQur Care. It is 888-55-CeQur. You can also reach us by going onto the website, myceqursimplicity.com, and contact us that way. But we're happy to help identify, not only help when you do have the product, but we're happy to help you kind of work your way through the insurance process. So that's perfect that you were saying that, Max and Vesta.
Thank you.
We do have, I will also pass on a message of thanks. So I can't even count how many messages that have popped up saying thank you both for sharing your story. Everyone's very, very happy to learn more about not only the product, but from you guys, from your successes, and they're congratulating you on how well you're doing.
Thank you so much. And I will have to add, do not wait for this opportunity. If you are a person, doesn't matter your age, but if you are a person, especially with a very, very beautiful lifestyle, don't compromise your lifestyle. Absolutely. Find out more information, contact your primary physician. If you have an endocrinologist, that would be the best person for you to talk to. And I have to tell you, you will not regret this opportunity. I'm so proud that 2021 for me has been the blessing in disguise with CeQur patch, definitely.
Awesome.
That is awesome. You guys have been fantastic tonight. I wanted to say thank you. Colleen, there are two questions that maybe you can quickly address. I think Max touched on one. How do you know the correct dosage without checking your blood sugar? So I think it was kind of brought up, but maybe you can talk about how you handle dosing with your patients.
Well, with mealtime dosing, we really do need to know what your blood sugars are before, so continuous glucose monitors are great, but sometimes not everybody can have one of those. So we do need to be checking blood sugars before you eat, and then maybe the next meal to see how it works. I mean, the dosing is going to be very individualized to how much you take and how we transition from pens to the CeQur, but your mealtime dose should be the same. If you were taking 6 units from a pen, it'll be 6 units from the CeQur or 3 clicks. So I hope that answers the question.
No, I think that's fine. It is dependent on each individual, and it does depend on their blood sugar, but that's usually calculated between the clinician and the patient, right?
And that's what's nice about this is that, like we said, Max puts in 100, Vesta puts in 200. So it's very individualized. So we've got to, no matter how much you take, we can accommodate you. So.
And one of the other really quick questions. Go ahead, Vesta.
You have a set, Colleen gives you a set amount of units per meal, plus a sliding scale. So it would be like 10 units plus 4 for your sliding scale, depending on how high your blood sugar is.
And that's all individualized.
That's how you know.
Every person's different, but yeah, so hopefully you've got some kind of direction there. And then we adjust, we see how it works and we adjust.
And then a follow-up to that, one other question that I thought you could address quickly is, what do you do with your basal insulin? We've talked about mealtime insulin, but what do you do with your basal insulin?
Excellent question. So this CeQur Simplicity is just for mealtime insulin, just Novolog and Humalog. So we know that we need some kind of long-acting insulin in the background. So that again continues the same. Whatever you were taking before will continue. We may adjust it because your blood sugars are better, but you still need to do a long-acting. So you still have to probably do 1 or 2 shots a day, but that's better than 5, 4. So we still need that long-acting, that basal insulin.
Well, this has been awesome. I'm going to join in with everybody and say a hearty thank you to both Vesta and Max. Congratulations on your successes that you relayed to us. And thank you, Colleen, for moderating the discussion. This has been wonderful. We certainly appreciate it. So thank you, and thank you everyone for joining. Don't forget, if you do have questions, feel free to call CeQur Care at 888-55-CeQur or visit us at myceqursimplicity.com. Thank you all and have a great night.